John, right? Yeah, you know what? Like I like to work things until they totally break.
Hey, I got cars at 20 years old.
Yeah.
My friends used to laugh at me because I would work on my cars and my dad taught me. And so they'll say, hey, I need you guys to do X, Y, Z. And I said, no, I was like, come on, man, you guys supposed to do this. They said, no, we know what kind of power is over there. I was like, yeah, you guys are just here. You don't know what you're doing.
Yeah.
Tina and I now.
Yeah, I'm sitting in today, so
okay.
Looks like we have a full house. A lot of recognition.
Oh, okay. I was like, whoa, we got people speaking.
I do have, I think that's that there's one speaker, and then
is this someone trying to protest this for Mercy or something?
I'm working with them, but I think it has to do with hiring staff.
Oh, better than well,
We're alive. That's our birthday.
it's weird because the Renisha, I used to really feel like, okay, what the heck is going on? Then I would talk to HR.
Oh, no.
Yeah, and then I find out they're not telling the rules.
Well, and HR is presenting today, so I think they'll touch on it.
Oh, okay. Right, which is interesting because the questions I would ask one, because I'm like, okay, you're missing this, and I know this is coming.
Yeah.
Put this out here.
Those two are definitely, I'm assuming you would also be, I don't have no,
Right.
Jay is connected.
I don't think I've ever tried to criticize anyone. I think that's not my role. That's not my role. My role is to help.
Yeah. All right. Well,
Anyway.
we'll see.
Yeah, hopefully it won't be bad.
Yep.
Yeah, I could give you, we would have like the resume from nominating committee.
So I was gonna.
Mm-hmm. Here.
I don't know where she went.
Get you.
Yeah. No, I was telling Dr. McKay, like, this is the first time I don't present on the strategic plan in a while. And it's like, well, you're not totally on board. Yeah. It is. So we'll bring it back to the board in August with the finance. So.
Okay.
Yeah, right. Congratulations, by the way.
I got both. Oh, it's straight. Straight. I do have it. I'm sorry. So last December, I gave the whole board with socks with their photo on it.
Yeah, he went on, out of town. I don't know, Florida maybe?
Okay. Okay, good morning, everyone.
Good morning.
Good morning, thank you. Vice Chair, I'm Raul Garza, and I serve as the Chair of the Cook County Health Board. And I want to welcome everyone to the meeting. At this point, I'd like to call the meeting of the board to order, and I would like to please ask the Secretary to call roll.
Director Bott?
Present.
Director Green?
Present.
I believe both of those are remote, but I'll circle back. Director Harrington?
Present.
Director Kim? Present. Vice Chair Larry?
Present.
Director Masuda Barnett? Present. Director Ryder?
Dinner's here.
Director Robinson?
Present.
Director Sorrell is absent. Director Staines? Present. Director Webster Cross,
Present.
I believe is remote, and Chair Garza.
Present.
You have a quorum. And just circling back to those remotely present, we have Directors Bott, Green,
Present.
and Webster Cross. If you can confirm, please.
Yes.
Yes. Yes.
Thank you, Madam Secretary. So we do have a new board member who was recently appointed to the board, and I'd like to ask everyone to please join me in welcoming Heather Staines. But before you do, I just want to say a few things. I've known Heather for a number of years when she served in the state Senate, and her work was very critical to Medicaid reform. So she knows the healthcare space from multiple levels, and I would just say I think she's here at the right time. So Heather, welcome to the board, and everyone please help me in welcoming Heather. And Heather, I don't want to put you on the spot, but didn't know if you wanted to say anything.
Sure. I'm a huge fan of Cook County Health, and it's just such an honor to be able to serve and learn with all of you. The work is just so critical, even more so now with what's happening nationally, and I know the hospital will continue to be the place that everyone can get the health care they need, so it really is an honor, and really look forward to it. And I'm delighted that I get to start with someone else who has experience here and really get to learn from all of you.
Thank you, Heather, and thank you for that segue, because I do also want to recognize Gina Masuda Barnett, who I haven't met with you formally yet, but I want to welcome you, and I look forward to meeting with you. And thank you for volunteering your time. I know you've had a rich history with the county, serving, I think, over 20 years in the public health system, and then on to the Michael Reese Trust Foundation. So, Gina, welcome. Great to have you. Is there anything you'd like to say?
No, nothing additional to add outside of that. Cook County Health really does have a special place in my heart, and I'm glad to be here during this time and be able to serve on this board. So thank you.
Thank you. Welcome both. Thank you. The next regular meeting of the board, yes. The next regular meeting of the board is scheduled to be held on Friday, August 22nd at 9 a.m. And so I would like to entertain a motion to allow directors, let's see, Jay Bott. I know we have two others, Mia Webster Cross, and I know there's a third participating remotely. Deb, who am I missing? Is it Maya Green? Dr. Maya Green?
Dr. Maya Green,
Yep.
Dr. Bott, and Mia Webster Cross.
Yes, so I'd like to entertain a motion to allow those three directors to remotely participate in this meeting as a voting member.
So moved. Second.
Thank you. The motion has been made and seconded. Is there any discussion on this motion? Seeing none, I'll ask all in favor, say aye.
Aye.
All opposed? The ayes have it, the motion carries. Thank you. The first item on today's agenda, which I always find to be really one of the best items, probably the best item, is employee recognition, which will be reviewed by Andrea Gibson, who's stepping in to help in this role today. Thank you, Andrea.
Thank you, Chair Garza. We'd like to start today by welcoming some new leadership hires. Ellie Bain, Chief Legal Officer. Ayakunle Abagunde, Chair of Gastroenterology. Hopefully I didn't butcher that too badly. Edgardo Javier Madero, Executive Director of Surgical and Procedural Services. Karen Hughes, Director of Talent Acquisition. Amy Melvin, Director of Tuberculosis Prevention and Control. Carissa Sutherland Smith, CCHIP, Director of Behavioral Health Counseling Services. Lauren Hollowell, a Pharmacist Manager. Kyla Quigley, a Program Manager for Communicable Disease and Prevention and Control. Lashina Miller, Senior Project Manager for HIV Services. Tracy Litwin, Corporate Communications Manager, and Amani Harris, Communications Manager. So welcome. A few more new leadership hires Frankie Russell, Manager of Quality Care and Population Health for Health Plan Services, James Olaowe, Nurse Coordinator 2, Christopher Sada, Nurse Coordinator 2, Lisa Brown-Reed, RN Coordinator, Bed Management, Salil Gassemi, Clinical Operations Nurse Supervisor. Welcome to CCH.
Yes, welcome. Let's give them a round of applause.
Next, we'd like to extend our congratulations for promotions, including Craig Williams, Executive Chief Operating Officer, Christina Torino, Chief Operating Officer for Health Plan Services, Rachel Senecal, Associate Chief Data Officer for Analytics, Jennifer Rosenich, Associate Chief Data Officer for Clinical Analytics, Claudia Birchinall, Executive Director of Ambulatory Care Operations, Cynthia Washington, Executive Director of Patient Services for Finance, George Papadopoulos, Director of Environmental Public Health, Joseph Teves, I forget how to say that, Director of Nursing Operations for Endoscopy, Renata Rags, Manager of Financial Counseling, Lamont Boswell, Senior Manager of Complex Care Coordination. And that's, so join me in congratulating those promotions.
I thought we didn't give promotions to people Red Sox.
We had to make an exception in this case, yeah. All right, we have another handful of recognitions, some achievements of our team. Notably, we achieved recently the Joint Commission Equity Certification. We're really proud of this. We earned full certification with 0 findings, which was unusual in the history of the equity certification. So congratulations to the team that worked on that and accomplished that. So thank you.
Yes.
Andrew, let me just say in regards to that recognition and that certification, that at a time when equity is being challenged, I think it's even that much more important that the county achieved this. So again, congratulations.
In addition, I'd like to acknowledge the Providence Scholarship Fund. On June 26th, Cook County Health and the Cook County Health Foundation announced our 4th cohort. We awarded over $1.5 million in scholarships for 106 students who are pursuing careers in the medical field. So well done to the team that put that together.
That's huge.
Next, Cook County, and if anyone is here associated with these recognitions, please stand when I talk about it. Cook County Health is recognized by the American Heart Association for turning guidelines into lifelines. So we earned several American Heart Association Get With the Guidelines Achievement Awards for coronary artery disease, heart failure, and for stroke. So please, I know there are some of you out there, please stand to be recognized. The neuro team is here. Next, we have the Department of Medicine Unsung Heroes. So I think some of you are here. Please stand. So it has become a tradition of the Department of Medicine to recognize the unsung hero in each medicine division during the faculty and staff meeting held at the end of the academic year. The recognition honors individuals who demonstrate relentless effort, commitment, and dedication, often working behind the scenes within their division and department. So congratulations to all of you. Next, the National Medical Association. We were proud to welcome the W. Montague Cobb Board of the National Medical Association during the NMA's annual scientific meeting last week. They made a generous donation to the Cook County Health Foundation for the Providence Scholarship Fund, and we're grateful for their support and celebrate the association's mission to advocate for health equity and eliminate health disparities. All right, I don't see Manny Estrada here today. Maybe he's online, but a special congratulations to Manny Estrada, who's Chief Operating Officer for Correctional Health, for being recognized by the Health and Medicine Policy Research Group as a Health Award recipient. The Health Award recognizes an individual who advances public health, equity, and improvements in the health of a specific population. So congratulations, Manny. Next, we've started a program called Cheers for Peers, and the first winner is Sharon Barnes. I don't know if she's here. There she is. Okay. Sharon received 27. Okay, well, clap.
All right.
She earned the top spot of her from her peers across the organization. She was nominated for outstanding contributions to the administrative team with CCH Department of Family and Community Medicine. So thank you, Sharon. We'd also like to acknowledge the Daisy Award winner. Congratulations to Stroger nurse Surpriza Villagomez. I don't know if she is here today. I don't think so, no. The Daisy Award is a recognition program to celebrate and recognize nurses by collecting nominations from patients, families, and coworkers. So congratulations, Surpriza. Next, we have a First Ladies Initiative 2025 on Sunday, June 30th. Cook County Health participated in the First Ladies Initiative, which seeks to bring health resources to African American churches around Cook County. This year, staff from CCH, CCDPH, County Care, and CCHIP promoted the health system resources at 15 churches. Organizers were grateful for our efforts, long-term partnership, and commitment to bringing resources to the community. So thank you for that. We'd also like to acknowledge the more than 50 Cook County Health staff who represented CCH and County Care at this year's Pride Parade. CCH board member Dr. Maya Green was named one of the 2025 Community Grand Marshals. Kudos to all for making a fantastic celebration. And my favorite recognition is for the 2025 Bike Commuter Challenge. Congratulations to all 44 members of the CCH staff who conquered the Active Transportation Alliance's 2025 Bike Commuter Challenge. Cook County Health came in first among public agencies and fourth among all teams, and over 100 teams participated. The CCH team logged a total of 5,181 miles, saving almost 2 million grams of carbon emissions, and nearly half of our team logged at least 100 miles over the challenge. And we see a couple members here today, including our and Kathy Chan. So. Great. And while I have the microphone, Deb has asked me to give the ARPA update. So we have moved up from 73 million in expenses to 77 in expenses this month. We still are pushing hard to maintain about a $5 million a month expenditure pace as we get towards the end of ARPA, which ends at the end of 2026. So with that, I'll turn it back over to Chair Garza.
Andrea, thank you, and congratulations to everyone. In addition to the recognition, the great work, it's also always, I think, amazing to see the depth and the spread of the work that we do in just about really every corner of the county, and you see the impact in all these community events. So I think that goes far beyond any other healthcare system that I know of. So thanks to the staff for all their commitment and work. At this point, I want to go to public testimony. As a reminder, written testimony will not be read into the record, but will be included in the official record of this meeting and posted to the website. Madam Secretary, do we have any speakers who registered to provide a in-person or virtual oral testimony or submitted written testimony?
We have one virtual speaker who registered, Brenda Langford. Ms. Langford, are you connected?
Good morning. Yes. Can you hear me okay?
I can. So as we get you have 3 minutes, and when we get to about 2 minutes, 30 seconds, I'll give you a quick reminder.
Yes, ma'am. Thank you. Good morning. My name is Brenda Langford. I'm a registered nurse who has worked for Cook County Health for 27 years. I'm also a proud union nurse who serves on the national board of the NNOC and NNU union. I come before you today because we are about to begin contract negotiations and felt it appropriate to report back on the conditions at the bedside. Over the years, this board has heard scores of nurses report on a variety of issues, but mainly about staffing. This is still consistently the #1 issue in all of our bargaining surveys and internal polls that we conduct in our membership. Watching the board meetings over the past several months, I want to applaud the board for its endeavors to improve the staffing situation for all classifications, including nursing, by converting agency positions to full-time county employee positions. These efforts, I believe, are sincere, and the reduction in agency contracts in the fiscal year are proof of that. However, we have a long way to go in converting these positions, and to be frank, the nurses on the ground are not noticing a significant difference. In the summer of 2021, when we concluded our last round of contract negotiations, we had 1,261 nurses working across Cook County. As of June 2025, we now have 1,263 nurses. That is a net gain of 2 nurses over 4 years. Management has agreed to hire 300 new nurses in 18 months when we ratified the last contract. We knew it was ambitious, and to your credit, you did increase the budget, and we now have over 1,800 budgeted RN positions. But do the math, though. That is over 500 unfilled vacancies. And do you know how many have been posted in the month of July? Was 43 out of 550 positions. Hundreds of these positions have never been posted. Dozens of others were taken down years ago and never reposted. To have a net gain of only 2 nurses over 4 years represents failed leadership, and someone should be held accountable. In my assessment, the fault lies primarily with Cook County Health's own HR team, who do not seem to share your stated goals of converting agency positions. In my role as a PPC, which is a professional practice committee member, I have collected names of dozens of agency nurses who have sought positions but struggled to get interviews or callbacks from HR. In October of 2024, we shared those names with Rachel Morello and others in HR to try to help with recruitment. We were rebuffed and told that we don't represent agency nurses and that there were no anomalies in the instances that we brought to their attention. Such a response is unacceptable, and we as union nurses are going beyond our job duties to recruit nursing talent, and we are told everything is okay when we know it is not. We work alongside those agency nurses, and they tell us they're not getting interviews and they're looking for employment elsewhere. The data does not lie. And as of May of 2025, we have over 400 agency nurses working across the system on an average. The agency nurses have been working at the system for over a year, and some have been working here for as long as 5 to 6 years. I don't want to point out problems with no solutions. Some of what we're doing show a significant promise, like recruitment bonuses and extra shift bonuses and expedited hiring procedures. Due to these efforts, we have seen an increase in onboarding in the last 10 months or so, but we hope to build on these endeavors in our upcoming negotiations. So what else can we do? Listen to the union nurses instead of rebuffing them as Rachel Morello did when we tried to assist in recruitment. Start interviewing these agency nurses and post hundreds of vacancies right away instead of just only dozens. Thank you for your time.
Thank you, Ms. Langford. Are there any other speakers?
There are no others.
I do want to comment on your testimony, just say that, well, first, thank you for the recognition of the things that are working well and the improvements that have been made. I will speak for the board because I know we've talked about it. This is a major focus of ours, and we know there's more work to be done, and we're committed to ensuring that that's being done. And I know I've spent time with Wayne Guerin, who oversees this area, and he's committed to ensuring that we flatten that curve of capacity available for nursing roles at the county system. Thank you for your feedback. I'll go to item 4 now. The minutes of the June 27th board meeting are being presented for your approval. Are there any corrections or revisions needed to be made to these minutes?
None here.
Thank you. I'd like to entertain a motion to approve item 4A, the board meeting minutes of June 27th, 2025.
So moved. Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion that we need to have? Okay, all in favor, say aye.
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 All opposed, nay. All right, none. The ayes have it. The motion carries. At this point, I'd like to go to Director Harrington, who will review the Audit and Compliance Committee meeting minutes.
Thank you, Chair. The Audit and Compliance Committee met on Friday, July 18th at 9 a.m. Nicole Monroe, Chief Corporate Compliance and Privacy Officer, reviewed the report, which included information on the following subjects: metrics first and second quarter of the county FY 2025, which included the System Compliance Program and County Care Medicaid Plan Compliance Program recoveries, as well as compliance education and training updates. The committee went into closed session and received a closed meeting report. The board will receive a review of that report during today's closed session. Since there are no Audit and Compliance Committee action items associated with the closed session, the minutes can be approved at this time.
Thank you, Director Harrington, for the review. I'd like to entertain a motion to approve item 4B, the minutes of the meeting of the Audit and Compliance Committee of July 18, 2025. I've heard a motion made. Is there a second?
Second.
I heard a second. Is there any discussion on the motion? Hearing none, all in favor, aye, please.
Aye.
Aye.
All opposed? The ayes have it. The motion carries. Next, I'd like to move to Vice Chair Lowry, who will review the Managed Care Committee meeting minutes, please.
Thank you, Chair. First, I'd like to note, due to the verbosity of some of my colleagues on the Cook County Board, I had to recess the scheduled Health and Hospitals Committee meeting on Wednesday to yesterday. And I want to just thank our entire CCH team who presented for their willingness to sit out the scheduled day and then return yesterday. I really appreciate your time and your contributions once you were able to present your reports. I just wanted to publicly say thank you. I see Craig in the room. I'm going to point to you. Dr. Joshi, I see you. If there are others, I'm just not seeing you, but I really do appreciate that. I want to say that. With that noted, the Managed Care Committee meeting was convened on July 18th, 2025. We received a report from Aaron Galiner, Chief Administrative Officer for Health Plan Services, and other staff on the following subjects: health plan metrics, policy updates, health choice RFP, quality. I believe the mnemonic is CAHPS, but it's CAHPS. We had a report relative to that. That stands for Consumer Assessment of Healthcare Providers and Systems. And we considered the CAHPS measures based on the adult survey respondents, the adult survey ratings, an overview of child survey responses, child survey ratings, and then we looked at or heard about measures to continue to improve not only CAHPS measures, but also HEDIS, HEDIS, which is Healthcare Effectiveness Data and Information Set. We then received a marketing update from Alex, which was just phenomenal, showing the outreach and the import of what we're doing and getting the provision of our services out to the public. So I applauded that. I also noted during our meeting that I recently attended the NACO conference in Philadelphia. That's the National Association of Counties. And I had a national resolution in support of preventative health screenings in the context of prostate, breast, and lung which was unanimously approved during that session. And of course, that is an outreach of the program that we started here January of this year, which is my birthday health screening program, where now residents of Cook County, women 40 and over, can receive free mammograms at Cook County health facilities, and men 45 and older can now receive free prostate screening. So again, just shows the import of health screenings, early detection, and we are saving lives. The next regular meeting, scheduled meeting of the Managed Care Committee would be held on Friday, October 17th at 10 a.m. And if there are no further questions, the minutes are being presented to the board's consideration at this time.
Thank you for the report, Vice Chair Larry. I'd like to entertain a motion to approve item 4C, the minutes of the meeting of the Managed Care Committee of July 18th.
So moved.
Second.
The motion's been made and seconded. Is there any discussion on this motion? Hearing none, all in favor say aye.
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 All opposed say nay. Ayes have it, the motion carries. I would ask for a motion to allow Director Sorrell to remotely participate and be a voting member of this meeting.
So moved.
Second.
We have a first and a second. Any discussion? All in favor, say aye.
Aye.
All opposed? Motion carries. Welcome, Director Sorrell. At this point, I would like to move to Director Bott, who will now review the Quality Patient Safety Committee meeting minutes. Director Bott.
Thank you, Chair Garza. Quality and Patient Safety Committee met on Friday, July 18th at 8 a.m. The committee approved the following action items, which are included in the minutes. Approved 1 Sturger Hospital Division Chair initial appointment. Approved Sturger and Provident Hospital medical staff appointments, reappointments, and changes. The committee received the following reports, which are included in the minutes. Operations Excellence Dashboard Goals and Tactics, and a terrific report on Substance Use Disorder and Recovery Support Services program in the system. Next meeting of the committee will be held on Friday, August 8th at 9 a.m. If there are no other questions on the minutes, they're being presented for the board's consideration at this time.
Thank you for the report, Director Bott. I'd like to entertain a motion to approve item 4D, the minutes of the meeting of the Quality and Patient Safety Committee of July 18, 2025, which include approval of the following items. 1 is the Stroger Hospital Division Chair initial appointment, the Stroger Hospital and Provident Hospital medical staff appointments, reappointments, and changes.
So moved.
Thank you. Is there a second? Second. Thank you. I'll let you figure out who got there first, Doug. Any discussion on the motion? None? All in favor?
Aye.
Any opposed? Okay, the ayes have it, and this motion carries. At this point, I'd like to move to Director Ryder, who will review the Finance Committee meeting minutes.
Thank you, Mr. Chairman.
Sure.
Finance Committee met on Thursday, July 17th at 10 a.m. The committee considered the following action items, which are included in the minutes. Conditionally approved 25 contract procurement items, number 4, 7, 11, 15, 17, 19, 20, and 22 are pending review by contract compliance. On the screen, you'll see the contractual requests from the Finance Committee meetings. Fiscal impacts are greater than $1 million, which are highlighted for your information. We received the filed grant award related items, and we received the filed transfer of funds. I want to thank Commissioner Lowry for taking the gavel, and I was not there for the first part of the meeting, so he took care of all this heavy business. The committee received the following reports, which are also included in the minutes. Report of the May financials, monthly report on our agency reduction plan. A request was made regarding a review of financials. It was for additional information, data on the work done to determine patient eligibility and enrollment in various federal and state programs and care link. Follow-up request made regarding the monthly agency reduction report included top code, agency use line request. The request is for future presentations reflect the agency uses percentage for each job classification, and request for information regarding the factors contributing to the decline in agency use of clinical nurses. If there are no questions, the minutes are being presented for the board's review, approval at this time.
Thank you, Director Ryder, for your overview. I'd like to entertain a motion to approve item 4E, the July 17th, 2025 Finance Committee meeting minutes, which contain the following action items: conditional approval of the contracts and procurement items pending review by the contract compliance, and receiving and filing the grant award related items and transfer of funds.
Second.
Thank you. Motion's been made and seconded. Is there any discussion on the motion? All in favor, say aye.
Aye.
All opposed? All opposed? Hearing none, the ayes have it. Motion.
Chairman, we also acknowledge the passing of Terry Garland, who was a longtime head of nutrition at Stroger Hospital, who retired in 2022 after almost 30 years working in our hospital system. Essential both as a leader of the organization, also for support making our board meetings functional and accessible for the public for many years. Proud member of IBW 134 for 43 years. Father of Walter Carlos was also a member. Always led by example, go above and beyond, help anyone in need. Many here at Cook County Health. Thank you to Deb Santana, who I know made an extra effort to make sure that we properly recognized Brother Garland. So,
Thank you, Bob. I think those kinds of recognitions are important. Somebody who gives their career, their life to the county and the people of the county. And we wish his family well during this difficult time, I'm sure, of his passing. But thank you for raising that. We are moving to item 5 now, which is contracts and procurement items, and none are being presented. So we'll go to item 6, report from the chair. You have to give me some grace because it's my first meeting, but I'm just pleased to have been asked to perform in this role, and I look forward to working more closely with the staff and certainly my colleagues on the board. So thank you. Next up is the CEO report, which will be reviewed by Andrea Gibson, our Chief Strategy Officer, on behalf of Dr. Eric Makaitis.
Actually, I think I already did
Oh,
with the ARPA. I put it in at the beginning.
Got it.
Apologies.
No, thank you. Okay, so the next items are informational reports. First up is Dr. Karan Joshi presenting the CCDPH quarterly report, followed by Wynn Barron, our Chief Human Resources Officer, presenting on Human Resources Committee metrics.
Thanks so much, Director. So good to see you all this morning. I want to, before I get into the presentation, I want to pause and just acknowledge my colleague who'll be presenting most of the slides here today. George Papadopoulos is our Director of Environmental Health. Mr. Papadopoulos is a licensed environmental health professional and has over 30 years of experience in environmental health at CCDPH, and as such brings a wealth of knowledge. As you can see from the overview slide here in front of you, we're going to give you a broad overview of the CCDPH Environmental Health Unit, and we'll go through sort of initiative by initiative. And we'll close out with some planned next steps. Next slide. I always want to ground all of our presentations in sort of like a baseline understanding of what it is that CCDPH does. And so as you can see here from the slide that I've presented previously, we protect health, prevent disease, we inform and engage the public, and we analyze and share data for action, all with an eye towards advancing health equity. In today's presentation specifically, we're going to focus on the regulatory aspect of the work that we do, including health inspections, and you'll hear the rest from Mr. Papadopoulos. That said, I'm going to turn it over to him.
okay. Thank you, everybody. Can you hear me? Is it,
Yes,
like that?
thank
Okay,
you.
good to be here today. Thank you for the opportunity to talk about what we do on a daily basis. I'm going to read the mission statement, and it's the only thing I'm going to read off the slides today. The Environmental Health Services Unit strives to preserve and protect public health through primary prevention, utilizing a combination of education, enforcement, and assessment programs designed to identify, prevent, and abate environmental conditions that adversely impact human health. So, like most mission statements, nice words, but what do they mean? So hopefully, during the course of this presentation, keep those words in mind and it adds color to the whole picture. Next slide. Okay, so Dr. Joshi struggled to say environmental health practitioner. Officially, that's what we're called. The job titles in the county call us sanitarians. We're commonly referred to as the health inspectors. The term environmental health causes some people to think custodial services. I've actually received email requests from people in this building to clean their bathrooms. I politely said that that's not what we do. But in general, we're a team, a group of individuals that are specialized, have technical expertise. We inspect, we investigate, we use our observational skills, we make reports to determine conditions in the field, and we're going to go through the various programs. Our supervisory and managerial staff is all licensed by the Illinois Department of Professional Regulation, just like the doctors and the nurses are. But the public health industry is dwindling, and this expertise is kind of going out the door. So as people retire and move on, there's going to be less and less knowledge available, and expertise may be lost. With that, we can just start going through the next slide. I'm sorry. So basically, we receive funding from corporate Cook County, about $1.3 million. The rest, or a good chunk of the balance, is from Illinois Department of Public Health funding, mostly the local health protection grant, which we split with our communicable disease unit. So roughly half and half of those funds are allocated to each of those units. We do bring in additional revenue. We have license fees. We have contractual services with multiple municipalities, intergovernmental agreements with the state of Illinois Health Department to bring in additional revenue in addition to these license fees as well. Next slide. Okay, now we're just going to go through basically what services we provide. The retail food program is what I started with many years ago. I came as an intern, 3-month internship while I was working on my master's degree in public health at the UIC. Apparently through some payroll glitch, I'm still here. Anyway, so everybody thinks that Cook County covers the entire area. There's plenty of jurisdictional issues with Cook County you may or may not be aware of. I'm sure that it comes up in other areas as well. But for our department, we only officially license and inspect facilities in unincorporated Cook County. So that is a dwindling and smaller area geographically. Little pockets here and there that we, as the county agency, are the default, or the default responsibility lies with us. But many years ago, we started an intergovernmental agreement program with the municipalities to conduct their inspections for them. And currently, we've had we do have 29 agreements with suburbs throughout suburban Cook to inspect their facilities generally twice a year. We also do their plan reviews, look over their blueprints for new establishments, follow up on any complaint investigations, outbreaks of illness, which by definition are 2 or more households. Like a husband and wife would not be considered a household, or separate households. You would have to have like 2 unrelated individuals. But as soon as that is triggered, we respond immediately, generally that day or certainly by the next morning, to follow up with that restaurant to see what issues may be occurring and what we can do to educate first and then enforce if necessary. The last few years, there's been an expansion of home-based, or what's called the cottage food program, where it's kind of been a little bit of a headache for us because when I first started, we used to be able to say, if somebody asks, what can I make from home, or how do I go about preparing food items from home? The short answer and the honest answer was always, I'm sorry, you can't do that. That's no longer the case, and with the way the economy has evolved, there's been more and more requests for home-based businesses, and these applications are kind of overwhelming us because we're responsible for the entire county. It's not just the municipalities that I was referring to before, where we can refer to them locally. They have to come to us, and we have to review each application that comes across our desk. We have not a huge staff, but we do a lot of inspections. The annual amount is about $4,000 per year. With the intergovernmental agreement fee for service, that generates $300,000+ a year as well to support our services. Yes, sir.
Yeah, I want to provide context. There are over 130 municipalities in Cook County. The city of Chicago is just one. And so we're looking at 130 municipalities. You might have agreements with 29.
Right.
But it's a daunting task because there are over 130 counties.
Thank you. Next slide. So a couple of these programs, the tattoo and the body art facilities, the tattoo and body art and the tanning facilities are also something that came into the regulatory realm like 20 plus years ago. The facilities are inspected by us via an intergovernmental agreement with Illinois Department of Public Health, and that's throughout suburban County. So we basically cover all those facilities with annual inspections and prior approvals as they come up. We check for bloodborne pathogen training, autoclaving the instruments, are those corrected and not causing any issues. As far as the tanning facilities, we look for timers on the machines, sanitizing the machines, cleanliness, sanitation, age restrictions. As I mentioned up top, the timing as well. It has to be automatic 10-minute setting before somebody cooks a little too long. Next one. Okay, we're in the middle of summer, so this is something that is kind of hot and heavy for us during these months. We only have a short window between Memorial and Labor Day to do most of these facilities because obviously they're operating during the summer months. We cover, again, via intergovernmental agreement with the Illinois Department of Public Health, over 900 facilities, which actually translates to 1,500 plus features, which includes the indoor pool, the outdoor pool, the spas, hot tubs, splash pads that the kids play with. And that covers the whole breadth of the county. So we have a wide area to be out, and with a short time frame and limited staffing. So this is always an annual challenge for us. But we check for the pool chemistry, we check for safety equipment. We respond to any kind of, God forbid, any drownings. We haven't had one in several years. Any kind of rash outbreaks or illness reports, we respond to those as well. And again, we do charge the facilities for the inspectional fee, and that brings in some revenue annually as well. Next slide. Retail tobacco. Basically, we're monitoring or checking that the underage sales are not occurring. Many years ago, we used to do undercover stings where we'd send youth to attempt to purchase something, some tobacco product, and but we've ceased to do that. But in the current years, or the recent years, we've been providing inspection, making sure that the signage is available, that they are not selling to minors, and also that another recent ordinance that passed via Cook County for unincorporated only was the flavored tobacco products. Those are prohibited anywhere in Cook County. We had one facility that we had to take through administrative hearing because as the inspector asked them to remove the product permanently, they were restocked as soon as they left or walked out the door. So there were some fines associated with that that the administrative judge issued, but generally those have been resolved and been progressing smoothly since. Next slide. Vector control. West Nile virus is the heart of this program. Back in 2002, Illinois was on the front pages and nationally the highest case and death rate in the nation from this new and emerging disease. Since then, we've been doing our best to protect and promote prevention through media campaigns. Fight the Bite is the slogan that I'm sure you've seen around. We purchase advertising on radio, bus terminals or bus stops, buses themselves, digital marketing. But basically, we monitor West Nile virus activity in areas that are not covered by mosquito abatement districts. And as you may be aware, the mosquito abatement districts are taxing bodies unto themselves. So they receive funding, but there's through some historical anomalies, there's certain areas that aren't covered. So we fill in the gap there, more targeted as opposed to the broad media campaigns. We actually test mosquitoes. We used to collect dead birds, have them analyzed. The mosquito testing was to monitor or surveil West Nile virus activity in the area and then take appropriate action afterwards. We responded just recently to a complaint from a school about some increased tick activity. We had a commissioner reach out to us regarding just the students and the teachers complaining about having excess tick presence in the area on the school grounds. We went out, we did what was called a tick drag, had the ticks tested, analyzed for disease that came back negative, but you know, that was just an example of something recently that's been done. Next slide. So lead poisoning program is a multi-unit, multidisciplinary team that responds to elevated levels of lead and blood levels of lead for children generally. That's throughout Cook County as well. Many years ago, this was just a one-person operation. It's grown a little bit or steadily over the years, so this has become more fulsome and robust. Our team goes out, actually measures lead levels through an XRF measuring machine that's utilized in the homes. Check chipping, as you see in the picture, any chipping paint, if that's ingested by the children, that's a good way to obtain lead poisoning. The headline this year is that we used to follow up on levels of 5 micrograms per deciliter on children. That has been lowered this year to 3.5. So the cases have been commensurately increased by looking at 50% this year, just on the request on the activity. There are some available programs where the hazards can be mitigated through funding. Again, that's diminishing as well, including whether it's the renter or the owner. That's a newer feature as well, where the renter was able to qualify or apply on their own versus just the landlord. Next slide. So nuisance program is, nuisance is just a catch-all phrase for you're affecting others. Could be garbage pileup, could be rodent insect infestation. Some of the angriest calls you'll ever get are from people wanting to complain about a nuisance. It could be mold that their landlord has neglected. It could be high weeds, tall grass. This is, and unlike the other facilities where we regulate, we issue licenses, we can take some regulatory action. These are a lot of times just neighborly disputes where you really have to get in the weeds, so to speak. Document, take to, if there's no response, no cooperation, these can be elevated to administrative actions, administrative hearings, fines, etc. Next slide. Mobile home parks. So we license and inspect 12 mobile home parks in unincorporated Cook County. Now 12 doesn't sound like a lot, but that's over 4,000 individual units that are spread out that are on these properties. We look for we inspect the common areas, especially garbage, water supplies, any other safety hazards that might be tripped. This is a revenue generating program as well, where the owner is, his license fee incorporates the number of units on their property, or how much space they're renting, and then in turn request the annual inspection, which we provide. Next slide. Water, private sewage. This is foundational core public health. Most of us are city boys and girls. We're on public water, we're on public sewer, but there are little pockets of areas throughout Cook County that have their own well water supply and their own private sewage disposal system or septic system that must be applied for through our department. They cannot install a new septic system. They cannot drill for a new well. They cannot abandon or seal an existing well without obtaining a permit through through our department. We review their plans to make sure that the sewage areas are some distance from the water supply, and also we inspect or test water throughout these areas. Sometimes there might be some restaurants that are not hooked up to the public system, so those annual water checks, checking for E. coli. If any results come back positive, we have them chlorinate, check if there's anything else much more serious going on. We might order a boil order, or instruct them to serve bottled water only. So those are like some of the options or some of the remedies available to us. Next slide. So generally, when I've done some of these presentations before, I just throw up the pictures, and then just let the pictures do the talking. There's a lot of activity going on. It's hard to verbalize, but these are pictures of a lead inspection. The gun-like instrument is the XRF machine that is actually measuring lead in the paint. That's analyzed. Sometimes they'll take the chipped paint, send that to the laboratory for analysis. Next slide. The one on the left is a tanning bed. I don't know if anybody's ever cooked themselves like a hamburger, but when we first were asked to inspect tanning facilities, there was a pushback from many of our staff members years ago, because inspecting them somehow is giving tacit approval to the operation even. And as the public health people, we promote staying out of UV direct rays, obviously. To the right is a swimming pool inspection. That's deep in the bowels of a pump room. We inspect, I forgot to mention earlier when I was covering the swimming pools, we cover hotels, motels, park districts, water parks, condo associations. Those are the types of areas that you see public swimming pools, and those are the areas that we go into. So generally, our people are not wearing suits going out into the field. Like I said, they're getting their hands dirty and really getting into the weeds. Actually, that you say that that's one of our top nuisance complaints is abandoned pools, and it's we'll take like the larvicide pellets and we'll like over the fence we'll kind of like throw them in there. Those are mosquito hazards.
I tell you what, you leave it for 1 day to trash. Oh my God.
So in summary, I mean, I guess that comment summarizes what we do. Like, people experience these things. They eat in restaurants. They go to public swimming pools. They visit tanning facilities. They get tattoos. And there's always that, well, why doesn't somebody do something? Well, to the extent possible, we're the people that like try to do something. So we're the regulators, we're the enforcement arm of the agency, and like I said, our staffing is small, but I believe our output is high. And Dr. Joshi, I think, wanted to make a few more comments.
Thanks so much for that, George. I hope that this presentation gave you all a sense of the breadth of activity that's happening on the part of this unit in CCH across suburban Cook County. I did want to give you a sense of some future directions that we're interested in advancing One, I think we had a discussion about the lead poisoning program earlier this year. I do want everyone to be aware that we're very sensitive to lead poisoning prevention specifically, and the fact that we are going to require additional capacity to address the increased caseload resulting from IDPH dropping the lead level as per George's earlier comments. And as such, have received a lot of support from CCH leadership to sort of make that expansion happening. So we will report back on that in the coming months, potentially next year, to brief you on what it's going to look like, what our plans are going to be going forward. And the second thing is that with respect to the food program specifically, we've had some outreach over the years, and George could probably add color to this as well, from municipalities who have said to us, we're struggling to sort of do these activities on our own. Would you be interested in engaging with us and conducting inspections in our municipalities? We don't necessarily have the capacity to expand very much now, but we are interested in making the business case for an expansion given the revenue that is generated by this program. We think that there is a good business case as well as a strong public health case, of course, which is foundational. So thank you once again. Really appreciate your engagement and happy to answer any questions that you may have.
Yes, we do have some questions. Director Harrington, then we'll go to Director Ryder.
Yeah, it's not really a question, it's an observation. Most of my career was spent in public health, and I want to commend you for the work that you do. I also want to make it clear that the work you do saves lives. What we can't do is quantify what that is, because you can't measure what doesn't happen because of an inspection, because of somebody got an inoculation somewhere, for the work that public health do. So what people don't really understand is we prevent a lot of things, bad things, and death is one, from happening based upon the work that's being done. But you can't count that because it's impossible to count that. So I want to ask my colleagues to join me and give you a round of applause.
Yes.
Oh, very good. Great point. Thank you very much. No, I appreciate that and take that to heart, because that's the one thing I've struggled to say over the years in this profession is, like, how do you prove the negative, right?
Right. Yeah.
It's always, if you're doing a great job, then it's like there's no need anymore. The same thing, we were in COVID too. That I didn't have any slides on COVID, but we were the COVID mitigation response team. We responded to masking complaints, workplace violations, et cetera. And again, proving the negative is pretty tough.
In 2007, that was the first foodborne illness that was detected in the city of Chicago, at Taste of Chicago. Every day they have a cadre of food inspectors on site, and every morning they go out, they examine the ovens to make sure that they can heat the food, they check the refrigerators to see that they are capable of storing food, and they respond to problems in real time based upon being on the ground. So there's a lot of work that goes into these large events that seem to be not apparent, but they do save lives.
Related to that, I see a lot of food trucks nowadays.
Oh gosh, yeah.
So does it make the work?
So we've tried to scale this a little bit. We don't have jurisdiction throughout the entire county, as I tried to make that point. So to the extent that we can scale to the municipality and let them handle their events, their licensed operators, that helps us. We will provide consultation if there, as a backstop, and that's kind of how the intergovernmental agreement program sprung up years ago. There were these gaps. It's like, who's actually qualified and who's actually servicing or inspecting these facilities. It used to be, the nephew of the mayor, or maybe the fire chief himself was going in. So we tried to standardize and make uniform the inspectional process itself. As far as the mobile or the units, I'm sorry, got a little off.
they are popping up as much as like those home-based business, and they kind of overlap. And there's this thought like, well, I'm going to work out of my basement or out of my garage. I don't need to follow any regulations, and that's not fair to the existing establishments, the operators that have been following the rules for years. And all of a sudden, imagine having a brick and mortar operation selling hot dogs for years, and then a hot dog truck parks in front of your facility. So there's a give and take on that.
Director Wright?
Yeah, I was gonna echo, Joe's comments in that working people go and use public pools, right? They go and, fast food all the way up to, you know, the local diner. There's this perception of safety when you go into some of these places because you can smell chlorine, right? But the smell of chlorine isn't necessarily mean that the bacteria in the pool has been disposed of,
Right.
or that there's not another place like in the washroom or the showers, or when you go to a restaurant, no one's making the decision to go in a restaurant that has mouse droppings in it.
Right.
Right. So when we hear things like, you know, when I was a kid, it never hurt us to drink out of the water hose.
Right.
And I'm like, well, based on the adult decisions you're making now, I'm not sure that it did it. But I also think that public health didn't show up yesterday.
Right.
So I just want to echo the continued vigilance of our public health professionals, in that they've been keeping us safe from a variety of things for decades, and it gets better every day. And you know, the burden like of the lead pipe standards changing, it's a challenge, but it's also a good thing because this is going to help protect, you know, brain development of kids so they can be smarter than us one day.
No, I appreciate that, and I have an anecdote to supplement what you said. So when I first started, I was told to go inspect a hot dog trailer that was just randomly plopped up on Illinois State Tollway property. He just appeared one day, and he was doing baffle business. It was crazy. And they're like, how did he show up? Anyway, so they sent me out. I had just been starting out, and first thing I asked him was like, where's your water supply? And he had showed me the garden hose from like this building, like two lots over, running through the grass, and that's exactly
Right. Right.
So you were spot on.
Yeah, no, absolutely. I mean, we make, you know, there's a lot of jokes about dirty hot dog water, right? You don't want dirty hot dog water.
Right.
So,
Make me nauseous. I have a question about the collaboration amongst municipalities and how, among other things, public health data can be cooperatively collected. I know like a couple of months ago, there was a statewide data use agreement type of summit in Springfield. And the more I think about it, Cook County Public Health is the center of Cook County, but then there's so many municipalities, and you don't necessarily have, you know, power to actually request data, collect data together. It's just, to me, something that we need to establish, you know, public health data.
I'll take a stab at that, and I'd welcome you to respond as well. But I think you're spot on in terms of, like, the nature of our jurisdiction is highly fragmented, and that's sort of in contrast to the city, right? Because the city has one fire, one police chief, and so on and so on. And there are implications for health data. So for example, my colleagues at the city have much easier access to data from EMS, specifically from ambulance runs. And that's very valuable in sort of making public health decisions around, say, behavioral health outcomes like suicide attempts or overdoses and so forth. We have to take that data request to the state, right? And I think with some degree of rightly so, they're somewhat guarded about that. They want to be careful about distributing that data. That said, we do maintain quite a bit of health data on the Cook County Health Atlas, which I'm going to put in a shameless plug here for. If you haven't visited already, I'd encourage you to do so. There's quite a bit of data available that's at the municipal level and really allows you to drill down.
I mean, in fact, I'm part of the management team of Cook County and Chicago Health Atlas.
Great.
Working with every division.
Director Kim, can you speak into this? Yes, thank
But
you.
I think what you just mentioned is an example of, really important data that we don't necessarily get in a timely manner.
Correct.
So I was just wondering if you have plans to actually establish relationships with municipalities to receive, essential data. For example, EMR 911 call is one thing, and also I think, policing, crime-related data, will be very important for public health.
Yeah, I mean, I'd love to talk further with you about that if you have specific ideas. I know that data specifically, because we've had separate conversations about this, you have to get even more fragmented because some police departments, there's no electronic system. Everything is stored in some filing cabinet in the basement, right? And so getting access to that and being able to leverage it in a useful way, you start to get some issues there. So, but happy to talk, Director Kim.
Thank you.
Thank you. Director Robinson.
Just going to what Director Kim said, could you do something as basic as develop a form that they would upload to a secure site, and then you could actually gather that data and then create some form of database? Just an idea. That's not what I want to say, but once I heard it, it made me think about a very basic way that you could try to get some of the data. There were a couple statements made regarding the ability to forecast about death and disease as a result of not actually doing your job. That was said you can do it, making your business case. I would say you can actually do that. It's a fairly simple for analytical person to be able to look at that. To create benchmarks, you can look at unregulated places and see what they are, and then you can extrapolate what it would look like here. Again, a data person, which I'm quite sure we have here within the organization, could do that to create your benchmark. And then you would set that up to demonstrate this is what happens when we don't do our job or when we do not have any regulation or inspectors. This is what we are experiencing. Then you will show your worth. Because at that point in time, now we can see what did not happen. And that's done throughout other industries, and that's something that can be done with just talking to a data person. For a data person, that's not a hard lift at all. That's so simple. That's a walk in the park. The other question I had, I think you said you have 102 municipalities that you're responsible for.
No,
29 or 20?
29.
Right.
And there's 130 total.
Okay,
134.
134 total. Thank you.
Vice Chair Lowry.
Yes, I heard that. But the thing that I would like to present is when you look at, say, you don't have the funding for it, but if they have the need, could you develop a business relationship? Because that aggregate would allow you to say how many inspectors can cover X number of areas. And then that would be your charge or your fee to be able to do it, because I'm not against the food trucks, nor the person working in the home, but I think you make a very good argument to the established building who's playing by a different set of rules. It's not fair. Right. Nor is it fair necessarily to the public who's entrusting that I am buying something that will not create a problem. But if you were able to look at that and look at those different districts, get the numbers and come up with an agreed price, then that might allow you to be able to ensure that people are getting safe food and cover the areas and make it fair to the people who are paying the extra money and doing everything that they're supposed to do to keep everyone healthy. Just a thought.
You're absolutely correct, Director. Thank you.
Appreciate that.
Other questions? So, Dr. Joshi, I just want to say thanks for coming back around on the lead poisoning prevention efforts. I know it was a topic of interest, especially to my colleague, Director Robinson, a few months ago, so we'll look forward.
chose not to say anything today.
Oh, well, that's why I'm speaking. So, I just want to thank you for agreeing to coming back and giving us more follow-up on that. And once again, thank you for thorough review, very enlightening, and once again, congratulations on your promotion.
Appreciate that. Thank you for your time today.
Thank you. Thanks, everyone.
Oh, I'm sorry, not so fast. Director Bott did have his hand up, so he did have a question, I believe. Director Bott?
Thank you, Chair Garza. Just a quick item. I won't keep you all as you were shifting off the table there. Just to build on, I think, previous comments about our technology strategy, thinking about predictive analytics and other tools. I know, when I spent some time with the city of Chicago, we were able to think through that on lead. So just happy to help and talk through it further, but thanks for the great work.
Thank you. Thank you.
Thank you, Director Bott. 1 second. We have another director remotely that wants to ask a question. Director Green?
Thank you. Quickly, I know we're pressed for time. Thank you for all of these reports. It was very thorough. I just want to throw in there or ask, are we looking at, some people call it kratom, some people call it kratom. It is a substance readily available. And I know we move further off of that. I was waiting for the end of this entire report to say it. Are we looking into that? Because there's definitely the space there to head off some things as far as need for addiction treatment and help disparities. I know we're way off the topic, but I was waiting for the end of the entire report to just throw that here so it can be documented so we can, maybe have some thought on that maybe at a later date. Thank you.
So I'm not familiar necessarily with kratom, but is this CBD or Delta 8 type cannabis product? Is that what you're referring to? So this is where.
Sorry.
Yeah, thank you for the question. This is actually a relevant current topic because this is so the CBD marijuana products are regulated, but that's not as a food additive though. And FDA considers it an adulterant and not an approved product. So we've had some facilities attempting to infuse product in a food item for sale, and our interpretation via the state of Illinois is that that's not allowed, and there's really no regulation. So the question is just spot on and like topical for what the current situation is. We're looking for more guidance from the state at that political level to give us more definitive guidance on what to do.
Thank you. It's good to know it's on your radar. Thank you. That's it.
Thank you.
I don't know how to put my hand down, so I need help. Debbie, thank you.
Okay, I think, are we good there? Okay, we're good. Thank you, gentlemen. Appreciate it. Yeah. Okay, we're going to move to the Metrics Human Resources Committee report. That'll be given by Carrie Vogt and R.J. Dabney in lieu of Wayne Buren.
Yes, I'm going to pretend to be Wynn today, but I'm Carrie Primick-Vogt, the Associate Chief Human Resource Officer. And then I'm going to go through the deck, but if there are any questions, especially ones that I'm not able to answer, RJ is going to step in and help out. So, all right, the first slide talks about where we are with our recruitment activity and where we are with our vacancies. The graph on the left shows that we're holding relatively steady at 1,745 vacancies in the organization, which is about a 23% vacancy rate. It is down from 26% at the beginning lot of that is due to all of the recruitment efforts and the contractor conversion efforts we've had this year. Next slide. So our current state of hiring, we've had over 1,100 offers go out as of the end of June. And we've had a total of 794 positions filled, which is about 150 more than we did year to date last year. So we're ahead of the game. And with 579 external hires, which leads into our net time to, or our net fill, which is 272, which is again a good 150 plus more than we were year to date last year. So we're really making some strides on filling that gap and decreasing that vacancy rate here at CCH. Our separations are holding relatively steady compared to last year, but still much better than just a few years ago and far better than they were 4 to 5 years ago. So we've had approximately 307 individuals separate from CCH as of the end of June. Next slide. Go on to nursing hiring activity. So we've filled a total of 258 nursing positions as of the end of June, and 157 internal and external hires filling the frontline CN1 and clinical nurse 1 and clinical nurse 2 positions here at the health system, which we broke out even further to show you the areas that those clinical nurse positions work in on the far right graph. And then our following slide is our nurse hiring velocity and attrition rates that show we've had 291 nursing offers go out, and that we have had 86 external direct care nursing hires happen compared to 116 last year. We've definitely had a dip in our nurse hiring, but that was in large part due to the focus in the earlier half of the year on our contractor conversions, and we've now pivoted, and nursing has become another priority, and we are going to be working through the accelerated hiring process with nursing physicians starting as of this past month and moving into August, including adding in a hiring fair in August. We have our net hires for nursing at 5, again, much lower than it was in 2024, but we hope that that will pick up now that we've begun the accelerated hiring process again with the nursing, and we have some hiring fairs planned. And that concludes the metrics.
Yeah, during public testimony, it was said that we have, on average, 400 nursing positions vacant a year. Is that a correct number?
I'm not sure what the average is. She was not far off. She said approximately 500, and I believe it's 500 plus a little bit of change. That is our current vacancy rate for nursing.
And has that been historically from year to year? What?
We would have to check on that number.
Yeah, I think it'd be helpful to look at that.
Yeah.
And that would tell us if we're really making progress.
Question?
Yes, go ahead.
It's going in reference to the testimony that was given. I wanted to ask about the 500, but I think enough has been said. The dozens that have not been posted, is there any reasonable statement to add to that?
Well, without knowing the exact positions to which she's referring to, it's a little hard to pinpoint, but I would like to note that whenever we post a requisition for people to apply to, it very often, especially in the nursing realm, is not just for one position, but for multiple positions. So we may have a dozen or so requisitions that are up for posting, but it's tied to dozens, if not more, or multiple dozens of positions to each of those requisitions. And then our hiring fairs are usually not just for 1 or 2 positions, but are for anywhere from 20 to 30 or more positions, depending on the area we're hiring for at the time.
Okay, and also another statement that was put out is that the nurses have actually tried to make recommendations for people who are currently working, and it was somewhat rebuffed.
If you're referring to the contractor inquiry that came in?
I'm not sure what.
That she was speaking to,
okay.
yes. So those weren't really recommendations. We have a process that employment recommendations are going to be made that we would accept from anybody, regardless of whether they were union or the union itself. However, when
when they were inquiring about certain individuals, our policies and procedures prohibit us from divulging private information about applicants and candidates. So we couldn't share with them direct knowledge of those particular individuals. However, when we responded that, when we looked into those situations that they brought up, we did not find any issues, that we had followed all our policies and practices, we had found that we had done so.
Now, I find that interesting because that's not how it was presented. The way in which it was presented as if they made recommendations for people to be put into the pool of candidates, and that was rebuffed. That's the way the statement was, that's the way I heard the statement. So you're saying that's not quite how it would happen?
That's not quite how that situation came about, correct. But if that were to be a situation, we wouldn't be able to take that recommendation because it wouldn't follow our policies.
But there is a procedure for someone.
To make a recommendation, absolutely.
And Carrie, is there a procedure to have follow-up with the individual who was recommended, so they know the status of their interest or disposition?
All of our applicants and candidates receive follow-up from our recruitment team as they move through the workflow of the process, yeah.
Thank you. Yes, Director Staines, and then we'll go to Director Harrington. Director Staines.
Just a couple questions on the process as I'm new and trying to learn here. Okay, so from the information here, it looks like it takes 122 days to fill a nursing position. And, out of the 291 extended offers, 202 were accepted, which is about a 70% rate. Like, how does that compare to peer set? How long should it take to fill a position? What's your goal on that? What's comparable acceptance rates, and are there things that we could be doing to, improve those aspects?
There are things we can do to improve, and we have been working on those diligently. As a matter of fact, that 70% rate you were talking about is an improvement over last year when we had dipped as low as in the high 50s and low 60s for our acceptance rate. So that acceptance rate has increased dramatically over the past year as the recruitment team has made tremendous strides in engaging the candidates throughout and keeping them engaged through our long and lengthy process.
And how long, and what's that time like? How does that compare to what has been in the past 122 days? And
I don't know what it is specifically for nursing. We would have to look that up, and I know there's a team looking at those numbers right now. So we'll get back to you on that. All right,
thanks.
Thank you, Carrie. Director Harrington.
It's not really a question, but it's an observation based upon my experience working for the city and state. Both are under consent decrees, and hiring is very prescriptive, and there's a process you have to go through. So anybody can make a recommendation, but ultimately you have to go through the same process. And if you don't go through that process, then you're in violation of the consent decree, and I don't know if that's the same for the county. But it makes it even more difficult to hire, and probably at the university level. It makes it more difficult to hire because you can't hire a person because the person makes a referral. You have to have a process in place to vet the person, and it's got to be an objective process, and then you can hire the person. So recommendations are one thing, but the ability to hire is very prescriptive moving forward. And that might be.
And I think Carrie's actually an expert in this because we're no longer under the Shackman decree because of the work we put into the hiring plan.
You don't want to stop doing it.
Yeah, no, we have to, because we continue to follow the hiring plan. We're not gonna get ourselves in trouble again, which started decades ago.
Right.
Obviously.
Same process.
So, yeah.
Correct. We follow the similar process to the state, different litigation, but same outcome.
Yeah. Probably the same plaintiff. So.
Yes, in some cases, although they're differently named, so there are definitely different plaintiffs involved.
Fair and routine.
Yeah,
Exactly.
but I would, and which also, like, having a peer set is difficult for a number of reasons, because we're a unique entity, also with the unique set of circumstances. We have other unionized hospitals, but, we're not completely comparable to U of I, which is more of a research hospital, whereas we're a public safety net hospital with some educational components to it, so.
Correct.
But we do our best to figure that out.
Thank you. Other questions? Thank you, Carrie, for stepping in. Appreciate it.
I do think, yeah, I think at some point we were down closer to 100 days on cycling people in.
So for nursing specifically, we had gotten as low as around 77 days, and that was a couple of years ago when we 2 years ago when we were piloting the accelerated hiring process, and now that we are implementing it as a full provision of our employment policies, we expect that we should be able to get closer to that number again pretty quickly. With that being said, yes, we've been lowered for nursing specifically, but even on average for all of our positions, we had been in the 90s. Yep.
There used to be a chart that you would have on here that actually had the red line showing that would be nice to see that again, because the question can be answered before it is actually before that.
So the historical oversight slide, sure.
You showed it current, because you would have the XY diagram, and you would actually have the different lines to show what is the goal and where were you in reference to the goal.
And I want to commend the HR team, because like we're talking about a discrete part of what's going on in the whole universe. Like one of the things that we've been doing in the last year has been agency conversion, and which has had different phases, has been even more encouraging since late fall, I would say. And that's a lot. That's a lot to take on, because it's doing the regular job. It's fixing the agency problem that accumulated over the last 5 years, and it's like fighting two different battles on two different fronts, and still making progress. So,
Thank you for recognizing that.
Thank you, Director Ryder. Carrie, thanks once again. Okay, we're at item 9. And so the board will now be going into closed session. Action is not expected to be taken in open session after discussion in closed session. So at this point, I'd like to entertain a motion to go into closed session pursuant to the following exceptions in the Open Meetings Act 5 ILCS 120/2 C1, 2, 11, 12, 17, and 29. And we will need a roll call vote needed. So I need a motion and a second, please.
So moved. Second.
I've heard a first, or I've heard a motion made and seconded. Madam Secretary, will you please take the roll vote on the motion?
Roll call vote on the motion to go into closed session. Aye or nay? Director Bott?
Aye.
Director Green?
Aye.
Director Harrington?
Aye.
Director Kim?
Aye.
Vice Chair Lowry?
Aye.
Director Masuda Barnett?
Aye.
Director Ryder?
Aye.
Director Robinson?
Aye.
Director Sorrell?
Aye.
Director Staines?
Aye.
Director Webster Cross?
Aye.
And Chair Garza.
Aye.
You have 12 yeas, 0 nays.
Thank you, Madam Secretary. The motion carries, so we'll give a few minutes to clear the room. And thank you, everybody, for joining us today.